Nothing is more precious than our eyesight. So much of what we learn, what we experience, and what we enjoy comes to us through our eyes. If you're one of the millions of people who are affected by nearsightedness, farsightedness, or astigmatism, laser eye surgery may offer the vision you want without the constraints of glasses or contacts. PRK is a great option for patients who are not good candidates for the LASIK procedure. If you are ready to embrace vision without the need for glasses or contacts, consider PRK today.
A ceratectomia fotorrefrativa é uma intervenção que corrige a visão, dando nova forma à córnea. A intervenção pode ser usada para corrigir miopia, hipermetropia e astigmatismo. Primeiramente, são empregadas gotas anestéticas para anestesiar os olhos. Não são usadas agulhas nem injeções. Depois, o cirurgião remove o epitélio, que é uma camada fina de pele protetora que cobre a córnea. A seguir, pulsações de raios laser controladas por computador são empregadas para dar nova forma à córnea. O laser será programado com a informação obtida durante o exame pré-operatório. O tratamento com laser é concluído em menos de 1 ou 2 minutos, dependendo de quanta correção for necessária.
LASIK and PRK are common laser vision correction procedures, but they differ slightly. Usually, patients are first considered for LASIK surgery. If they are not a good candidate for LASIK, then PRK may be an option. Both procedures correct vision using targeted laser therapy. However, the procedure and recovery processes differ. To be a candidate for LASIK surgery, the patient's corneas must be thick enough. If the cornea is too thin, LASIK can weaken its structure, causing the cornea to bulge. This can result in decreased vision. PRK may be a better choice for some patients with thin corneas because the laser does not penetrate as deeply into the cornea as with LASIK. In LASIK surgery, the doctor creates a corneal flap, which is folded back as the laser is applied to the deeper corneal layers. After the laser treatment, the flap is repositioned over the eye. In PRK, there is no flap. Instead, the surgeon removes the outer corneal surface completely to expose the deeper corneal layers where the laser is applied. The deeper layers are left exposed. Eye drops, oral medication, or a protective bandage contact lens may be prescribed to manage discomfort while the outer layer regrows. Because of the time it takes the cornea to heal, patients may experience more discomfort and longer recovery with PRK compared to LASIK. Additionally, PRK patients may have more frequent follow-up visits with an eye doctor to monitor the eye's healing after surgery. Both LASIK and PRK are popular options for correcting refractive errors. The best treatment type depends on your unique needs. Let us know if you have questions about your options for laser vision correction. When you enter your PRK surgery room, you will begin by lying down on the procedure bed. Next, Anesthetic drops are applied to numb your eyes. The surgeon will then position you properly under the laser machine. A device will hold your eyelids open so that you do not have to worry about blinking or closing your eye during the procedure. The PRK procedure consists of 2 steps. The first step is removing the epithelium, the outermost layer of the cornea, which is the clear front window of the eye. Removing the epithelium exposes the deeper layers of the cornea. At this point, your vision may dim and become blurry. In the second step, the surgeon will use a laser to reshape the cornea for your specific prescription. You might see a blinking, fuzzy light. Your doctor will ask you to look straight ahead in order to precisely align the laser beam with your eye. When everything is just right, your doctor will activate the laser. Computer-controlled laser light pulses will remove microscopic amounts of tissue, gently reshaping the cornea. The pattern of laser treatment is determined by a sophisticated program and based on the detailed measurements that were taken during your preoperative examination. The laser light is invisible, but you will hear a slight clicking sound as the laser gently reshapes your cornea. Because your eye will be numb, you will not feel the laser, although it is normal to smell a faint odor. Before you know it, your procedure will be over, and the surgeon will place a special contact lens on the eye to protect the area while it heals. You will receive a shield or sunglasses to cover your eyes so that you do not accidentally rub them. New epithelial cells will grow on the cornea over the next few days, after which your doctor will remove the contact lens. Ask us if you have questions about the PRK procedure. There is still some time before your laser vision correction surgery, but these instructions will ensure that your procedure goes as smoothly as possible. Grab your glasses, you'll need them. Your doctor may recommend you stop wearing contact lenses in the weeks leading up to your surgery because they can affect the shape of your cornea or affect the results of any measurements. Be sure to pick up your post-operative eye drops from your pharmacy before your procedure and apply drops as instructed. Also, make sure to coordinate a ride home from the procedure because you will not be able to drive yourself. On the day of your surgery, be sure to double-check the surgical center's address. This location might not be where your consultation took place. It's also important to arrive about 10 minutes before your appointment and bring all necessary paperwork, including your consent forms. It's safe and even recommended to eat and take regular medication the day of your surgery. You should come to the appointment in comfortable clothing. Do not wear any makeup, perfume, lotion, or hair products which could interfere with the laser. Remember to bring sunglasses. In some cases, sun protection may be provided, but having a pair of your own sunglasses is handy. Your eyes may be sensitive to light after the procedure. Following these instructions will reduce the risk of having to reschedule the procedure. In the meantime, if you have any questions, please give us a call. After the PRK procedure, you'll usually be able to go home within a few minutes, though you'll need someone to drive you. It is normal for one eye to feel different from the other, and to notice red spots on the white part of your eye. It is common to experience blurry or hazy vision after the procedure. Your vision will gradually improve for days and weeks that follow, and visual recovery may take longer for farsighted patients. Plan to stay home and take it easy for a few days following the procedure. If you have itching, burning, or a feeling of sand in the eyes, closing your eyes for a time can help. Also, eye drops or oral pain medication prescribed by your doctor can provide relief. If your eyes are sensitive to light after the procedure, you should wear sunglasses during your recovery. After a few days, you will be able to go to work, drive, and resume normal activities. You will probably be asked to avoid swimming for at least a couple of weeks after your procedure. Though you can generally bathe, shower, or wash your hair beginning the next day, you should try to avoid getting water directly in the eye. But if some does get in, dab lightly to dry and do not rub. Your doctor may advise you to avoid working in a dusty or dirty area. Also avoid wearing eye makeup for a period of time after your procedure. A few days following the PRK procedure, a new epithelial layer of cells will grow back over your eye's surface, and your doctor will remove the contact lens in a follow-up visit. As with any other surgery, always follow your doctor's instructions and take any medication prescribed. It's important to attend follow-up appointments and routine eye exams as advised so that your doctor can monitor the healing process. If you have questions about what to expect following PRK surgery, don't hesitate to ask us.